Hi, I'm Michael Scherneck, President and CEO of Southeast Georgia Health System. I'm here with Dr. Stephen Mosher, Infectious Disease Specialist, to provide an update on how best to mitigate the spread of coronavirus in our community. Dr. Mosher, the number of positive cases in Glynn, Camden, and McIntosh counties have really spiked since the beginning of June. Although I know that all of us are concerned about this increase, we're still seeing many people out in the community who are not wearing masks, or if they are, they're wearing them improperly.
I agree with you, Mike. The increase in positive cases is certainly cause for concern, especially with the state reopening and reducing the restrictions that were so helpful in preventing the surge we originally expected. The important thing for people to understand is that coronavirus is still a threat. We don't have a vaccine for it, and whereas we had hoped the spread of coronavirus would be similar to the flu and lessen when warm weather set in, that hasn't happened. The only effective ways that we know without a doubt will help to reduce the spread of coronavirus is social distancing and wearing a face covering when in public. If you're in an environment where you cannot be 6 feet away from others, you absolutely should be wearing a mask. We are aware of several outbreaks in establishments heavily visited by young adults. More than 50% of recent positive test results are in people less than 40 years old.
Absolutely, and wearing it properly. It doesn't do any good to wear a mask if it's not covering your mouth and your nose. This applies to all of us, regardless of age.
That's right. For proper protection, the mask should be worn above the nose, just below the eyes, and under the chin. It provides protection for others, and that's being kind. We're known in the South for our friendliness, for our politeness. Wearing a mask takes this one step further and visibly lets others know that you care about them and their health.
I know people are tired of coronavirus and ready to get back to normal, but is this our new normal?
That's hard to answer, Mike. We don't know when a vaccine will be available, and until one is, we can't predict when the threat of coronavirus will lessen. But for now, the best thing we can do is to continue practicing precautions. Wash your hands frequently, wear a face covering, and social distance. And make sure that you're encouraging others to do the same. We all know that the summer months bring a lot of tourists to our communities, and it's the time when we're planning our own trips and social gatherings. Now more than ever, we have to be vigilant and practice safe habits. Even if you're healthy, you can get coronavirus and spread it to others who may not be as healthy as you are. That's why wearing a mask is just the right thing to do.
You're right, Dr. Mosher. We do live in a very caring community, and the health system has experienced a lot of goodwill in the recent months from people who want to thank our team members, of whom I'm so proud, for their efforts during this coronavirus pandemic. We're very thankful for that. And I would like to add that even though we've said it several times, the best thing that we can think and the best way to show appreciation is by wearing a mask and social distancing. We're all very hopeful that we can start to reduce the number of new coronavirus cases and get back to our normal lives. And I just would like to thank you, Doctor, for all you've done during this such a difficult time and for all that you do for our community and our health system.